Hey, how are you? Hope all of you are well. It's your CPA Manish here. Nice to see all of you guys. Today we are going to do something very different. Today I'm going to have conversation with one of my very esteemed client. His name is Dr. Itay Wiser. He's a successful plastic surgeon here in Manhattan, New York City. And I'm here today in his office on Fifth Avenue and trying to talk with him and learn more about the client. So here is Dr. Wiser. Hey, Dr. Wiser.
Good morning, Manish.
Good morning. How are you, sir?
Great. Pleasure to be here with you.
Absolutely. It's a pleasure to talk to you. It's always such a pleasure to see you, meet you all the time. It's
Thank you so
amazing,
much.
right?
Same
So-
here.
So, tell us a little bit about you. Tell us a little bit about you, your practice, your background, your education. Give us a little brief about. I know you, but the audience doesn't. So, give us a little brief about you.
So, I'm 46 years old, Israeli born and raised, came here 6 years ago to New York to do a fellowship in reconstructive microsurgery. I trained at Lenox Hill Hospital and then did another fellowship on lymphedema at Memorial Sloan Kettering. And today I serve both as the chief of plastic surgery at Elmhurst Hospital, which is a Mount Sinai hospital, and in my private practice.
Right, but then the compromise is if you are with hospital and you are in private practice and you have a family and your two beautiful young daughters and beautiful wife, how do you find time for all this?
I sleep less. It is very hard, and you can add to that coming here as an immigrant 6 years ago, you have to also manage the cultural gaps that you learn
Right.
throughout the way. So it's a lot of being flexible, compromising, and I think also important taking a step back and assessing the situation in a timely manner every now and then to understand where you stand and where you want to go to.
And I forgot to mention with your family, you also are a very good piano player. First of all, let's show a clip to our audience what you do with the piano, and then we'll talk about that magic. All right, so that's amazing, Dr. Weiser. So, where did you learn playing piano?
At home. I had
Oh,
a
wow.
Well, I come from a Jewish Russian family. You don't have a lot of choices in those types of family. You either choose either the violin or the piano.
Amazing.
Yeah.
That was magical.
Thank you so much.
That's amazing.
I'm an amateur.
That's the least to say. All right. Coming back to your plastic surgery practice, right? Would you really advise the new doctors who are coming into practice now that they should go into practice or should they avoid private practice?
I think that the best thing that I can advise them is to consult with as many people as they can. Not to follow their steps, but to have their own, eventually their own opinion and decision about the path they want to choose. I don't think it fits everybody.
All right.
Private practice is a lot of responsibility towards other people, starting with your own family.
Right.
You take risks. You pay salaries to people, and they become your responsibility.
Right.
And you have the patient's responsibility.
Right. It's about the choice.
Yes.
It's about the choice for you. It's about the choice for the patients.
Correct.
So technically, private practice should never go out of business because it gives choices to you as physicians and to everybody else as patients, right? So that's amazing.
Technically, yes. And I think that deep down, people will never give up the the right to choose who treats them,
Correct. Especially in America.
especially in America.
Right.
I lived in Israel. The system is public mostly.
Right.
You cannot choose who's going to treat you,
Correct.
and this is why people go to private,
Right.
to the private medicine, private care. It's important because it's not just a skill, and it's not just a diploma on the wall. It's how the person, the patient, connects with who gives him the treatment. It's a mental connection,
Yeah.
and not just what comes before. It's what comes after.
Right.
And this is what I can offer in my private practice, and I cannot offer to all of my patients in the hospital, although I do try. About the ethical perspective of it, it is a very fine line. You stand, and I've stood in this scenario several times, and I guess I will stand there in the future again, where you see a patient that wants a specific procedure or treatment or service, and you know it will be a bad service for him. He shouldn't go under the knife, but you see a financial opportunity here.
Right.
And it crosses your mind. And then you say, well, maybe I'll cut corners, maybe I'll do that, maybe I'll just do this and this. There's no way around it. You got to stand firm, and you got to turn it down.
Understood.
And I've done that. I usually tell my patients, like, I would be happy to take your money, but
Right.
it's going to go bad.
Right.
The most common one is that I get people who are overweight, which I usually do not operate on, and they say, I don't care, do my surgery. I'll take the risk upon myself. I say, no, there's no such thing.
Right.
Once I put a knife on you, you're my responsibility.
Right.
That's it.
Right. Right. Amazing how our professions are very much similar. Very similar. You know, from whatever you just mentioned, there are few similarities. Right. In our profession also, a CPA could be skillful, could have diploma on the wall, but might not have the personal connection. Right. And in our profession also, we see things where our clients want us to do some things, and we go back to our clients and say, no, don't do it. It's not worth the risk. You know, you might see some financial opportunity at this time, and the clients would say, no, I'll take the risk. And I'll be, no, you don't want to take the risk. Doctors look good in blue or black wardrobe. They don't look good in orange wardrobes.
No.
So, you know, very similar, very similar. Thank you so much for your time today, Dr. Wiser. It was such a pleasure talking to you.
It was.
I hope to see you soon again. And next time, I guess we will talk about other aspects of your practice and your personal life.
We sure do. There's going to be to be continued.
To be continued. Yeah.
Fantastic.
Thank you.